So these are going to be the, just now we discussed the cardiac markers, that is creatine kinase. So this is an enzyme found in the heart and skeletal muscles. So possible cause of the increasing the enzyme in acute myocardial infarctions, myocarditis, that is the inflammation of the myocardium, and also cerebrovascular accident, muscular dystrophy, and chronic alcoholism. So this creatine kinase is going to be increased. So if anybody having, so this is the, in case of the pathological changes, it may alter. So this enzyme found especially in the heart and skeletal muscles. So if you see the normal values is going to be 38 to 174 units per liters in the men. So it will be in the, is a 26 to 140 in the in the women. So these are the normal levels. So who are having in the this pandemic situation also, many people are exposed to this type of test because of the one of the side effects after the COVID. Also, they may chance to get the so many heart abnormalities they can found who are having like a comorbidity risk factors such as the hypertension, diabetes, and also cardiac diseases. So, and also who are having the high triglycerides levels. So this also going to be is altered in case of the pathological heart diseases. And also myoglobin also. Myoglobin. So after the MI, the serum levels, myoglobin rise in the 2 to 4 hours. So after myocardial infarctions, so this myoglobin levels are going to be increased. So making it is early is a marker for the muscle damage in the MI. Possible cause of the increases including the MI, angina, other muscle injuries. And also in the renal failure and also rhabdomyolysis. So in those conditions, so this myoglobin is going to be increased. So this one is a rhabdomyolysis means. So what is the rhabdomyolysis? Is nothing but is this is the life-threatening syndrome in the breakdown of the resulting from the breakdown of the skeletal muscle fiber. So if any damage of the skeletal muscle fibers, so which lead the leakage of the muscle content into the blood circulations. Whatever the content is there in the skeletal muscles, so that is after breakdown, the content is going to be circulated into the bloodstream. So it may cause the severe damage. So may chance to get the life-threatening. And also the most common cause to factor for the rhabdomyolysis is the crush injuries. Crush injuries, if any severe crush injury, the fibers are going to get the damage or tear, or this the whatever the content is there is going to be released into circulations. And also overexertions. So in case of overexertions, and also alcohol abuse and certain medications and toxic substances and substance also may chance to get this rhabdomyolysis. So that is the breakdown of the skeletal fibers. So this normal value, if you see here, the 5 to 70 nanograms per the milliliters. So in the 1 milliliter, so is going to be the 5 to 70 nanograms. So these are the normal values about the myoglobulins. So coming to the troponin I and troponin T, so these are the cardiac makers. So this also is a highly concentrated in the heart muscles. So this test is used in the early diagnosis of the MI, myocardial infarction. After MI, after myocardial infarction, troponin 1 begins to increase 2 to 4 hours and remains elevated, is going to be 5 to 7 days. The troponin T begins to increase in the 3 to 4 hours, remains elevated for the 10 to 14 days. If it is elevated, is going to alter the cardiac muscle function. So it's going to be alter the heart function. So that's the reasons these tests are going to be very, very crucial to diagnose the heart functions, such as the and also myoglobin and also troponin I and also T and also creatine kinase. So these are the major like cardiac markers. So these are the these tests will help to rule out the myocardial infarction. Is there either cardiogenic or maybe it's because of the angina? We can differentiate it. The normal one is the values of the troponin I is going to be 0.35 nanograms per liter, and the troponin T will be is the 0.2 nanograms per milliliter. So these are the normal levels of the cardiac markers.